Tri-Cities region is one of the top spots in the nation for flu right now, and local pharmacists are dealing with a limited supply of medicine that could help.
Yeah, the CDC says Tennessee and Virginia both remain at very high flu levels on their flu map. The latest data from the Tennessee Health Department says hundreds in the Tri-Cities region were confirmed to have the flu the week after Thanksgiving. The Sullivan County Health Department had 259 confirmed cases. The Northeast region, which is basically the rest of the counties in Northeast Tennessee, saw 126.
The Walgreens Flu Index has more recent data showing that the Tri-Cities region is actually the 6th highest in the nation for flu. That data was gathered last week. But tonight, Tri-Cities pharmacists say they only have a set supply of the medications that can help the flu and other respiratory illnesses.
Kate Nemmerich spoke with them about how they're helping people fight off these illnesses.
Sarah, Josh, drug shortages are impacting drugs used for bacterial infections in kids and drugs that help adults recover from the flu faster. The amoxicillin shortage in particular is impacting children and what they're prescribed.
Amoxicillin is the first line for almost, I don't know, probably 75% of infant and childhood, infections. And a lot of upper respiratory stuff's going around.
Pharmacist Jacob Cox at Mooney's Pharmacy in Johnson City says they're getting a limited supply of amoxicillin into their pharmacy. He says when they receive prescriptions for the drug from doctors, they work to find other options and even call on other pharmacies in the area.
We're trying to work together to make sure, especially with the kiddos, that they go ahead and start their antibiotic as soon as they can.
However, Cox says they've run into some issues finding backup medications.
If you can't get that, then you can go to Augmentin, and then we're actually having trouble getting Enceftanir, which is the backup for amoxicillin. So now some of the backups that we typically use are going on back order as well.
Amoxicillin and other antibiotics won't be prescribed for viral infections like the flu.
If you have a bacterial infection, yes, they can help you, but most upper respiratory illnesses with a cough or without a cough, most ear infections even, most throat infections are going to be viral.
Tamiflu may be prescribed to help with flu symptoms, but pharmacists are seeing high demand for that drug as well.
It hits a whole school, all of a sudden I'll get 8 to 10 prescriptions in one day for the same drug, and I only keep 5 on the shelf.
Ballot Health reports the week of December 4th, they had more than 2,000 flu cases, with hospitalizations fluctuating from 84 to 117. With flu cases on the rise and limited access to Tamiflu and other flu drugs, doctors say those prescriptions should be reserved for those most at risk.
That's going to be patients over 65 years old, pregnant women, and children, really young children, especially ones who aren't old enough to get vaccinated yet.
According to a Ballot Health spokesperson, Tamiflu is available in their system. Amoxicillin is back ordered and expected next week, but they are able to compound in their pharmacies, so patient care isn't affected.